Oh, sorry,
To-
there's no camera. Yeah, no, I can probably ask for one.
Do you remember when I had my laptop like stacked up on books so that I could do it?
That's what happened when your chair is too short or you're too short. But
Maybe I'm
hey,
too short.
you do whatever you
Appreciate
can. So good.
All right, so I think maybe we'll wait just a couple minutes, see if anyone else is popping in.
Good luck, Tim.
Thanks.
Thank you for doing this.
Happy to do it.
Hi, Jay, welcome. All right, well, I think we have a pretty good crowd and more might pop in here in just a minute or two, but Tim, if you're ready, I'm ready.
Yeah, we can go ahead and get started here. Thanks again for everyone for coming to this.
Let me introduce you first.
Yeah, sorry, I was ready to go.
We need a formal introduction because we're so happy to have Tim Donovan here. So, although all of you probably know him, but Tim Donovan is our head of athletic trainer here at Wesleyan, and he's been in that role since 2017. He's been a certified athletic trainer for 14 years and working as a licensed athletic trainer here in North Carolina since 2011. Now, prior to joining us, he obtained his Bachelor of Science from Slippery Rock University and his Master of Science in Athletic Training from Ohio University. Now, as a healthcare professional, working with the collegiate population of athletes over that time span, he has seen the continual evolution of current best practices related to the management of sport-related concussion. And him and I have actually had discussions about this because he was so wonderful to collaborate with us on a study looking at sleep and depression after concussion just last year and the year before. Now, today's presentation, he's going to highlight recent recommendations from the consensus statement on concussion in sport, which was presented at the 6th International Conference on Concussion in Sport in Amsterdam in October 22. So I'll let Tim take it away. And again, thank you for meeting with us today.
Again, thanks for everyone popping in on this. And I kind of just to the point, Dr. Crowley was referencing about this being the 6th international one. I can recall when I was beginning my practice, these earlier versions of this, they didn't include anything at all about returning back to the classroom or anything along those lines. So over the last decade or so, there's been an accumulation of research about concussions. We're learning a lot more about it. And this conference essentially was an examination of the research that's out there and a big systematic review, that kind of stuff. And today we'll be talking a lot more in detail about the return to learn specifically, but we'll also look at a couple of different aspects to it as well. So as we go through here, we need to first, of course, start with a definition, right? A concussion itself is essentially a traumatic brain injury resulting from a blow to the body, head, or neck. And it causes essentially a disruption to the neurotransmitters process and the metabolic cascade of events, which results in dysfunction. These signs and symptoms may be present immediately. However, they may evolve over minutes or hours, and it's not uncommon to see people improve and then worsen over a period of time. Again, commonly can be linked with use of course, we don't advocate at all for any drugs or alcohol. Those things can definitely make it worse, but any physical activity, mental activity can definitely worsen symptoms if used too soon. And one of the things we'll talk about today is a balancing act in terms of when to incorporate physical activity as well as mental activity. But most of these symptoms often resolve within days, but it's not uncommon for the full resolution in terms of returning to sports and learning to be a little bit more prolonged potentially. You get a lot of questions from coaches and other persons about imaging studies. Often if somebody goes to the emergency room for a concussion, they'll do CT scan, and they're really doing that to examine and make sure there's no brain bleeding going on or a subdural or obviously hematoma. However, there is research currently that is documenting some changes as it relates to functional abnormalities that may be going on there, may be present. So we're definitely gaining a lot of research in those areas, but for clinical practice, these tools aren't available just yet. Within that consensus statements kind of came out the 11 R's for proper management. Step one, of course, is identifying them. What we do here at North Carolina Wesleyan is we, of course, we baseline all of our student athletes. We do two different baselines. One is the SCAT, and the other is the computerized neurocognitive test. We use concussion vital signs. The new guidelines recommended transitioning to the SCAT 6. So all of our freshmen this year have done the SCAT 6. Previous athletes were doing SCAT 5. And that is a standardized concussion assessment tool. We'll figure out if they have normal symptoms at baseline. Some of these kids come in, they have anxiety, they may have some depressive scores, they may have normal headaches, they may have some of the symptoms that can be associated with concussion. So it's important to potentially not necessarily identify somebody with concussion if they are normally having headaches and things of that nature. We also do scores on memory, concentration, and balance, as well as some visual and tracking tools. So that's kind of what the modified VOMS is. Essentially what you're doing that is, if you ever seen a DUI test, you're tracking the finger from one side to another, and you have the person falling with their eyes, and you can notice you may see with abnormal eye movements, what we call nystagmus, which essentially is a jump. So it should be nice and smooth and fluid as the eye is following it. If there are jumpy movements, however, that could be a concern. Also with near point convergence, when you would bring your finger and you watch and bring close your eyes, both eyes should converge on that point. However, if one deviates from it, that would be a potential thing that we could identify as a concussion. Sometimes those things all look normal, but we see a really hard hit, and somebody might say, I had a headache right away. So we may use that computerized neurocognitive test tool to get us more objective measurements, especially with things like reaction time. You can see pretty substantial differences in those. So we use a combination of all those things to do an assessment, because there's not just one thing you may need to use. Of course, we want to reduce concussions, so that comes to a lot of playing rule changes. Like I said before, in terms of if we suspect somebody's concussion, they're getting held out until we can either rule it in or rule it out. Anyone that has concussion is going to be referred to a physician at some point throughout that return to play / return learn process. And some of those ones may need additional assistance. Most will not need many accommodations. They'll probably just need some. We will definitely do reevaluating these things. So what we do a lot of times here within that process is we monitor them on a daily basis. So the student athlete gets a concussion, they are to check in with the athletic trainers each day to do a symptom monitoring. So we'll go through our full list of symptoms, 22 of them, ask them how they rate that on a scale of 1 to 6, and hopefully we see improvement as we're going along that process. Rest, of course, is indicated. Now we'll talk about relative rest versus the complete rest, which was previous recommendations. So we're kind of moving more towards a middle of the road approach with this. And we rehabilitate them, work on recovery. And then when it comes to actually implementing our return to learn and return to sport progressions, it's important to note that these are stepwise, meaning there's step 1, step 2, in terms of increasing activity as we're going along. They're both mental and or physical there. And one of the big changes with this consensus statement was, in terms of the return to sport, is you can start doing some activities while still symptomatic, but not up to a certain point. And I'll show an example of what that looks like here in a moment. And of course, you can reconsider. That is kind of along the lines of residual effects and when to retire somebody. And again, for anybody kind of coming in late here, there's the consensus statement, and then there's a whole bunch of sub-articles from that, identifying the return to learn, the reconsidering when to disqualify somebody. And there isn't a lot of consensus among this group about when the best time for somebody to retire is. I know I've had this conversation multiple times with different student athletes over the years, and there's not just a one size fits all approach to this. A lot of factors need to come into play: how many concussions, the timeline for those, how they've responded to them in terms of their recovery, what their risk tolerance is. So there's definitely a very important conversation that needs to happen between all relevant parties, between parents, the student athletes, doctors, other close people with them, in terms of figuring out what's safe. So that's kind of the overall big approach. Now we're going to really kind of hone back in here towards the return to learn process as it is here. As we're looking at this, again, highlighting the point of when we look at this consensus statement, they say in there that all the research articles looking at, there's more about return to sports than there is return to learn. So we're kind of having a bit of a dearth in that area, but there is growing research. We look at a timeline, what happens here, we get someone who has concussion, and they will be symptomatic at rest, and that's where we're going to have the greatest level of modifications, both for physical activity and classroom-related activity. And ideally, as they progress and they improve, their symptoms may resolve at rest, but with high levels of cognitive activity or physical activity, they may experience an increase in symptoms. So at that point, we can probably reduce some of those modifications and allow them to do a little bit more, but they're not fully ready to do anything without restrictions. However, when, of course, all these symptoms have resolved, that is when, of course, we can remove those restrictions within the classroom and on the field and allow them to return to activity in a safe manner. So as we look at this, in terms of return to learn, it takes a village really within this approach. And I think everybody being clear about their roles and knowing what's going on is important. So first and foremost, we have the healthcare professionals who are identifying these concussions. We have our athletic training staff here at the college, again, licensed healthcare professionals that specialize in sport-related injuries. You have nurses, physician's assistants, you have counselors, you have physicians, doctors. Sometimes we have specialty groups that deal with some of the more complex cases, those that would fall into the far end of the spectrum in terms of having very high symptom severity and needing additional accommodations over a longer period of time. A lot of times that will come from them. Of course, very important group here, the teachers, the educators, the professors, advisors. They need to be kind of aware of what's going on with the students so they can help guide them through the process and kind of have a good feel for where the current situation is. It's important to note that here, everybody has a very important role. Communication is really important, and having clear expectations about what's supposed to be going on with this. And one of the things, again, from this consensus statement that's shown out there, especially regarding the return to learn, is having a written concussion return to learn policy is really helpful to ensure ideal success. And it's even shown that written policies have a direct impact on the student athlete's overall well-being. So it's a win-win to make sure that everybody is clear about what should be going on and how this should be progressing. So over the years, we've kind of had a different end of the spectrum approach here. So a couple different analogies here. It's really walking a tightrope. What we'll talk about here when we talk to the return to learn is we want them to do some things soon, but if we do too much too soon, it can delay their recovery. However, if we put them in a cocoon and we don't have them do anything, that can also delay their recovery, right? So we want them doing some activity, again, from a physical aspect as well as a cognitive aspect. But, it's finding that just right approach that is kind of a bit of a challenge. So that's why it's important, again, to have open communication about what's going on with these student athletes. Again, that's really probably the biggest takeaway from today is find that balanced approach, because too little, if holding them out too long, is going to be bad for them, because we talk about that mounting paperwork that can build up, the anxiety over, if you have a type A person that needs to get straight A's, not going to class for a day is going to freak them out. All right, so that, of course, can be a problem. And then, of course, we have our other spectrum people that don't mind not going to class, and those can, of course, create their own set of issues. So we got to find the individualized approach with a balanced approach for these individuals is really the key here. So when we're talking about doing that resuming in class activities or sport activities, these should not really increase symptoms more than a mild level. And we'll go over that specifically here in a bit. But yeah, it's okay for these kids to get back in the classroom while they're still having symptoms, as long as those symptoms are on the lower end of the scale. And while they're doing these activities, again, physical and or mental, it's not causing a increase in their symptoms more than 2 points, essentially. And that's on a 0 to 10 scale. Like I said before, with the individualized approach, we're going to have a large rates of return here. Okay, the greatest indicator for a timeline is going to be that initial symptom severity or symptom burden a student athlete has. So if somebody has a score of 80 or 90, again, scales roughly goes up to about 120, they're probably going to have a longer return to full academics than somebody has a score of 8 or 10. The academic support, like I talked about with having the written policies and having these tools available, has a direct impact on these student athletes. So that is very important. A new update from this guidance is often, I'm not told athletes this myself, how medicine always changes in terms of recommendation. I told them to stay away from the screens as much as possible, but what we're seeing now is that the reduced screen time is most effective in the first 48 hours. And after that, the effect is kind of minimal, so to speak, as long as they're not increasing symptoms while they're doing it. So if they have photosensitivity or light sensitivity, then that's probably going to be something that will continue to need to be addressed in terms of reducing that. But if they are okay looking at screens, then it's okay to do so. On the right here, we have an example of what that return to sports strategy looks like. We're going to go over a couple of different versions of this, but the general principle is the same. First, you have to be able to do normal daily activities before you can even really consider resuming sports. When we do resume light physical activity, we typically don't move the head a whole lot because that up and down movement can irritate that healing brain. So we keep them, from either doing things like walking or cycling. And as they can tolerate that, they increase the physical activity to things like running and include sport-specific drills in the following step. Of course, take into consideration nothing that can cause a blow to the head to set us back and cause another injury, which we absolutely have to avoid. They have to get that medical clearance to resume full contact activity and competition. So this is the visual example of what I was just going over a moment ago in terms of the activity should be encouraged, right? As long as they're not increasing those symptoms. So if you're looking for a measure here, it's 2 points on a 0 to 10 scale. And these symptoms should not last for more than an hour. So for our student athlete, if they walk into your class and you ask them, hey, how you feeling today on 0 to 10? They walk in, they say they're feeling at a 4. Okay. Tell them if you feel like you're getting to a 6, let me know. Maybe you need to step out, or maybe you lay your head down on your desk, or whatever the accommodation may be, depending upon their symptoms or other things should be kind of examined there as well. So we want to have them being in it, but you're going to see, again, different rates of return among them. And get another little visual example here on the side here. So the first day or two, they may be able to do 5 to 15 minutes of activity. They may be able to do more if it doesn't increase any symptoms at all. But if they start experiencing some of that symptoms, that would be their kind of point to stop. Then they resume the homework and reading assignments, other activities of that nature. And again, the goal is to increase that tolerance or the ability to absorb that cognitive load. And then they may need to come to school part-time. So that can have a number of different versions of how they may look. They may get the okay to come into class late. They may get the okay to go to certain classes. For instance, it might be a bad idea to send somebody to a music appreciation class. They're going to have a lot of music and that kind of auditory stimuli or anything like that. Or if there's a lot of movement in there, it may irritate their visual stimuli as well. And of course, ultimately, we want to get them full-time academics. So overall, we would anticipate about 93% of students to have full return to learn within 10 days. So many are going to have minimal accommodations and things like that needed. But we're going to see the ones that will have greatest assistance will be those that have that high symptom severity, prior learning disabilities. They have history of dyslexia, ADD, ADHD, depression, anxiety. If they're going through any other compounding factors. So if they say it wasn't a sport-related thing, say it was a car accident and somebody else was seriously injured in it, they had that stress and anxiety, of course, those things going on there as well. So those are the ones that will probably need greater accommodations or greater assistance. You probably note there on the side that we have a 13 to 56, which is a pretty large range. And again, that is across different age groups for who actually needs the academic support. But again, like I said before, if student athletes need the support, 1, they need to know how to get the support. 2, it needs to be available for them. And 3, they have to follow through and take those supports as they come in there. And we're going to talk about each one of those kind of subsections there in terms of environmental, physical, curriculum, and testing accommodations as needed. And really, when it comes to that, like I said before, it's the individualized approach. Different symptoms may indicate different types of accommodations that would be warranted or needed. So, like I said previously, I would probably tell these kids not to do anything for the first 24, 48 hours. That was advice at that time, which now is outdated. So we want to have relative rest for the first 24, 48 hours. kind of keeping in mind that it's okay to do things like going for a walk, or again, potentially even listen to music or going to class, as long as it's not really exacerbating symptoms. So again, that 2 points on that 0 to 10 scale for less than an hour. If they're staying under that, they're okay to keep progressing, keep doing things. If they're doing more than that, what you're going to see is that excessive activity is going to delay their recovery. All right, so that can worsen their academic performance. It can slow the return to sports and classroom activity. So again, it's that walking that tightrope of doing enough early on so they're not having that anxiety over missing schoolwork, not, falling behind in class and failing class and start figuring out about that. And so we want to kind of guide through that minimal area there. So we also see that prolonged restrictions can be problematic too, right? So if we keep student athletes out of the classroom or having excessive restrictions on them within it, can also be problematic. So it's definitely not an easy thing to figure out, especially when, like I said, it's not all cases are the same. And we see those ones with a higher symptom burden. Again, that's a overall higher score in each symptom, and a higher number of symptoms is going to cause greater academic disruption. So, I mean, this isn't my final slide here, but it's kind of what's the best way to approach this? And the right answer here is we kind of have to figure it all out together in terms of the individual athlete, what they're experiencing. We have to consider the risk of substantial symptom exacerbation versus delaying the return too much. So it has to be somewhere in the middle when we're trying to find that approach. Now here's one of the excerpts from the article that's specifically focused on the return to learn. We can see an example here of what that looks like. Daily activities that do not result in mild exacerbation of symptoms. Again, 5 to 15 minutes is what we saw before, gradual return to normal activities. And then that next phase may be, again, these are people that probably have a high symptom score and may not be ready for the classroom. Maybe they're doing some homework outside of it, taking those breaks as they need to, and trying to stay up with the schoolwork, stay on top of their assignments as best they can. Again, probably with some modifications, set deadlines, etc. But they're still doing the work, so they are feeling like they're getting caught up, and that kind of stuff can be helpful as well. Then, of course, we want to get back to the classroom. There may need to be partial days. There may need that acceptance to come in late or potentially early. And sometimes, think about the high school, when the bell rings, those hallways get really filled up and crowded. That might be something we want these high symptom scores to avoid doing. So that could be one way to cut down the time, or maybe focus on specific materials as they're more indicated. Then ultimately, of course, we have that full return to activity without any restrictions. This is probably when they're symptom free and things of that nature. If just for comparison's sakes here, this is a new version of the return to sports strategy, which we currently haven't fully adopted as an athletic training staff here. We're kind of waiting on guidance kind of from the NCAA regarding these things, because we have to follow some of the guidance that they have. But we see that this one kind of allows us to do more physical activity at an earlier point. Typically, before, it really wasn't allowing you to start progression until somebody has completely symptom free. This allows you to start the progression while they're tolerant to that activity. And the basic concept here is these are student athletes who are very physically active on a normal basis. That's your normal physiology, the endorphins that get released, all this kind of stuff. Exercise is good for you, right? As long as we're not doing too much too soon, it can be beneficial in their recovery. And we saw a lot of this, and I've seen a lot of this firsthand. And I'm sure Dr. Crowley will tell you in the research she did over the last couple of years that delaying that physical activity has increased risk for depression, and it's something that needs to be addressed. And this is kind of one of the avenues to try to minimize those effects on the student athletes and trying to get them to being normal sooner. So hopefully with guided physical activity, we can minimize that return to sport as well as return to the classroom without any restrictions. So a lot of times we have the two different ends of the spectrum here, right? So again, each case can be individualized. I know a number of examples of student athletes that wanted to go to class the next day, and they did, and they were fine. They didn't have any problems at all. There were other ones that had a lot of issues, right? So these are the ones that I talked about before, having a higher symptom burden or presence of another morbidity, so to speak, either again, depression, anxiety, learning disability, any of these kinds of things. Of course, they can be problematic as well. So we want to consider those when we're trying to get them back into the classroom. And then said we have the issues if they stay at the classroom too long, these other things that can present themselves as well. So those are the ones where it definitely requires a lot of communication about those cases to make sure that it's getting handled appropriately. If there's concerns about balancing schoolwork, the depression, any kinds of things, they need to be expressed appropriately and early so we can minimize those effects, so to speak. So now we need to kind of talk about like what accommodations do they actually need to have. So keep in mind that depending upon what's available, because obviously we know here we have in North Carolina Wesleyan, that may not be the case at a high school. So kind of keep that in mind. What their symptoms are, what their needs are, what they're willing to do, what the professors are able to do. All these things need to be taken into consideration. So I pulled this from the Air Force Academy's little manual that they have. They did a pretty good job of breaking it down by symptom. So if somebody, for instance, has just general symptoms kind of all over the board, nothing super high, they may need extended time on assignments or quizzes. They may need to take a 5-minute break in the middle of class. If they feel like it's kind of getting to that 1.5 but not at the 2 yet, they might need to step outside, walk a little bit or sit down, not listen to see anything, let them calm down. Allow them to do things like quizzes, and again, maybe read the quiz out to them, maybe pre-print the notes, excuse absences, etc. If the headaches, again, this one thing that I've always advocated for people, especially if they had visual symptoms as well, is just to lay the head down on the desk. Be there, listen, know what's going on, so you can kind of absorb the information, at least auditory, not visually, but that is something is better than nothing. He said it's that relative approach. We have people that may have sensitivity to noise, so they may need to wear earplugs. They may need to avoid loud classes. I can tell you there have been a number of times where I've seen a concussed student athlete at a sporting event, and I've said, what are you doing here? I know it hurts you to listen to all this kind of stuff. It's hurting my ears. I know you need to avoid this kind of, because it's definitely not going to be proactive for their recovery. So tell them to avoid things like that. If you have light, and I'm sure you've all seen a student athlete inside wearing sunglasses at some point, because sometimes that bright light can be an issue. That may be an example where it's also helpful for them not to have to necessarily stare at a projector. So those pre-printed notes may be helpful in that instance as well. That may be one where we have that extension beyond the first 40 hours for limited screen time as well. Low light areas, dim areas can be beneficial as well. Sleep difficulties. One of the big problems I see with student athletes in the recovery is they take too many naps, frankly. You know what I mean? That sleep is good, essential for your recovery. But when our student athletes start taking naps at 5 o'clock and then they can't sleep that night, and then they miss class because they're sleeping in. So telling them to practice a good sleep hygiene is important. But sometimes it's more than that. Sometimes they have, again, these concussion symptoms, which make sleep not an option as well. So they may need to miss some additional time for that. I referenced a little bit about visual examples already. This could be an example where increased font size on certain assignments, let me watching TV, record lectures and let them listen to them. Again, pre-printing out notes so they don't necessarily have to look up to it or just kind of listen. And then, of course, a couple other areas here where we see things like modifying those assignments, where we, again, depending on what they need, they may need things getting read out to them bigger, or they may need extensions on assignment. They may need more time to do it. So then sometimes things need to be really adjusted on a large scale of that. Kind of going back to the consensus statement here, breaking these things, like I said, modify the school attendance. So we talk about the first 24, 48 hours, they may need a break, potentially even longer, because sometimes the symptoms may get exacerbated as they go to school. So sometimes they may need to go to class for a shorter period of time, taking those breaks throughout it. That can assist. Limiting any risk for any physical contact is absolutely critical. Of course, number one thing if somebody gets a concussion is you need to let that thing resolve without taking another blow to the head, because that's going to cause a dramatic worsening of the situation overall. So like I said earlier, in terms of leaving the class early to avoid those crowded areas can be beneficial. Not doing any activities that could cause, of course, risk to blows to the head or body, but allowing them to be physically active, because that is important for their recovery. So like I said, walking that tightrope and keeping things balanced. The pre-printed notes, the additional time on the classwork assignments is really helpful. Delaying quizzes and exams, depending on when the concussion itself occurs, they may need a extension because they might not be ready to sit down for an hour to do a test. So adjusting the programs as indicated for that, doing exams verbally, again, that visual cues in terms of going from up to down or right through can definitely be a problem for some of these kids. So kind of in a summary for where this is at overall, cocooning was often an approach that was used both for the physical activity as well as the mental activity, but it's been shown to be detrimental to their recovery. So that balanced approach is critical to allow them to do activity while we're not increasing their symptoms too much while they're going through it. And it's really unavoidable to have symptoms when you're not to have any symptoms when you're going through the concussion recovery. Most student athletes will need minimal accommodations. Most will have full resolution by 10 days in terms of classroom activities. What we see actually is the return to classwork will occur before a return to sports, and that's going to happen every time. And what we did see, though, is the return to that sport has actually increased over the last 10 years pretty significantly, and that's because of the we think that cocooning effect. We think that's been a little detrimental to the recovery, sort of trying to allow them to do more to do that. The upside of that delayed recovery time is we're seeing fewer repeat concussions. So again, walking that tightrope, we want them to return to activity sooner if indicated, but we don't want to compromise that for a risk of a subsequent concussion. So these plans, of course, need to be individualized. Student athletes will have different symptoms, different needs based off their previous history, the history of the concussion, all that kind of stuff will need to be factored in. And if you're trying to determine how long to expect somebody to have needs, that kind of stuff, inquiring about the symptom burden is a great question to ask. So is this person, again, are they on a high scale? They're in the 60s, the 80s, even the 40s aren't great, but if somebody's in the 15s, the 10s, the 20s, that's probably going to hopefully resolve pretty quickly. And because I always get questions in terms of people asking me about, what's a bad concussion? What's a serious concussion? And the short answer is we know after it's all done because of the duration of symptoms that they have. And the best indication you have while someone's going through the process at this point is how high are their symptoms. So sometimes those symptoms resolve pretty quickly, but more often than not, the best indication is for that long symptom burden and recovery process is having those extended symptoms. I know I had a couple questions before about some of those that couldn't make it, about some of the resources. Here are the ones we use for today. Definitely want to thank our library for getting me early access to some of these articles. Came out over the summer. I read them all pretty much right away. I was eager to see what they had said. And again, thanks for all coming in. And at this point, I'd like to take any questions.
Thank you, Tim. That was excellent. If there's any questions that you can ask directly, or if you want to put something in the chat, we'd be happy to do that as well.
Tim, I have a quick question. We're really good, and I really appreciate you and the athletic training staff being really good at getting that initial email out to faculty members to let them know that somebody's been diagnosed and that they're going to be in touch about a concussion. But it largely ends up falling to the student to update the faculty member as we move through the subsequent steps of them kind of reintegrating back into the classroom, back into competition. And sometimes that, if that kind of communication is very lacking, so faculty members don't know when to expect a student back to the classroom, or what, if any, limitations there might be on them once they come back to the classroom. And I wonder if you all have given some thought to how to stage that communication so that everybody's kind of in the loop as the student is able to take on more things, or perhaps has lingering effects that will affect their classroom performance.
That's a great question. I mean, one, of course, concern is HIPAA, which we actually updated our student athlete HIPAA statements to include faculty and staff on campus, professors, to kind of allow us to be able to communicate that. The other concern, of course, is the overall load of student athletes with what's going on. Sometimes it's a multi-party communication, right? So we may talk to a student athlete and they may tell us, yeah, I'm going to class, I'm doing great, I'm not having restrictions, so we may not feel the necessary need to follow through and follow up on that. Well, conversely, they might be telling their teacher, the professor, that, hey, I'm still having a lot of issues and have concerns. So I would say the door is open for anybody that's having concerns about somebody who's having prolonged symptoms or need those accommodations to just reach out to us and ask, hey, so-and-so has reported to me that they have concussion. What should we expect in terms of recovery timeline, or what should we expect as it relates to modifications in the classroom? Because what you see there is these recommendations for what they need is going to be really dependent upon those symptoms. So it's a balancing act in terms of respecting student athletes' healthcare privacy, you know, the HIPAA laws there, as well as trying to help them and help professors out at the same time. So we would definitely be open to kind of opening communication up with that to ensure that we have people recovering appropriately, and as well that we're not having people malingering with these types of things as well. We want to avoid that too.
And it looks like Dr. Marcel has a question.
Tim, I may or may not have handled the situation correctly with the student, so tell me if I did the right thing. I had a student that came in, they were under the concussion protocol, and in my conversations with the student said, well, I'm supposed to follow up with the doctor, I think, or maybe the trainer, but I haven't done that and I don't think I'm going to. What should I have done at that point? And then I'll tell you what I did.
Yeah, so sorry. So you should have said that in order to, you know, my understanding, again, depending on what their priorities are, right? If you need help in my classroom, I need to know from a doctor that this is continuing to go on, because when we send out our early alert, it's really just, it's a heads up that, hey, they may not be there for the next day. If they need additional accommodations about that they should be going through these systems, at least in terms of coming from Jessica Price Wilson or another medical provider or otherwise. If it's not coming from them, then, you know, you may just not know what's going on with them. You might just be like, well, I need something from a medical professional, is really what it would be. And if they don't follow up with us, then they're not going to resume sporting activity, because that's the constraint I have on them, you know, in terms of, you need to do this so I can do this for you. I can tell you there have been student athletes in the past who have had a concussion and have elected not to continue to follow up with us. And that's really frustrating for a number of reasons, because one, I want to know how they're doing, if they can progress in normal activity and everything else. And, you know, two, on your side of things, if they don't follow with me, I can't vouch for them or confirm or deny what's going on, so to speak. So what did you end up doing?
So I kept the student after class. And I said, well, I'm concerned about your decision. Let's talk after class. And so we did, and I helped the student understand the value of why they needed to go. I know they didn't want to go, but this is why they should. The student eventually went. In fact, I think the student went home and followed up with their own physician there. But again, I never knew what happened, but I was very concerned because you could see that the student was in somewhat distress in class. And that's what made me keep asking, are you okay? And how are you feeling? But again, I think that goes back to Dr. Lane's point about, you know, faculty need to be more aware of where they are in the protocol, which will help us also and help you as well.
Just to confirm, this was somebody who you did receive an early alert about, right?
Yes.
Okay, all right. Yeah, sometimes they don't tell us they get concussions, so that can be problematic. The way you kind of said there first, I was a little worried about that as well. Yeah. Because that, I mean, it's not uncommon for them to have something happen and try to hide it for a couple of days or something like that. That happens more often than we like, which obviously minimized that would probably put them in that higher symptom burden. You know, we have those ones that get an initial blow and then they hide it and then they take another one and then they're a whole lot way worse off than they were. Those are the ones that probably need problems. Those are the ones that need additional accommodations, as well as the ones that trust-wise I'm going to have concerns with, because they didn't have the trust to report it initially and have already demonstrated a challenge in managing that thing appropriately.
Well, and I think that's what this student's concern was, is that they knew that they hadn't fully recovered and they didn't want to be told you're not fully recovered and you can't go back to the field. And so I think they were trying to figure out a workaround.
Yeah, they lie to me all the time.
Yeah.
That's one of the reasons we have that online neurocognitive test, because I know one of the course progression points is having zeros in all their symptoms. So if they know that, they very well may say that. And that's where, even if I share this information, which again I'm willing to do, they may tell me all zeros, and they may go take that computerized test, and they may do very poorly in a couple of different sections. So I'll say, well, maybe not fully recovered. And I'll say, well, yes, I am. And then if I'm reporting all zeros and I report that to you, then you all may think, oh, they're okay. So we do have that potential athlete trust issue. I mean, again, they're competitive athletes. They love playing sports, you know, and you see that again, it's not a distinct North Carolina Wesleyan issue. It's athletes across all levels. So that's definitely a challenge. But like you said, I think a little more open communication about where they're at in the process, especially for the ones that are the cases that we're having those issues with. Like I said, for those simple cases where they're progressing well, they may have just, you know, not been there for a day and they come back to class and they're doing everything and they seem normal to you. I don't necessarily think we need to worry about those ones. But if you have somebody who, you know, 24, 40 hours plus is still demonstrating issues, or you have ongoing concerns, I think that inquiring directly to us about those would probably be the most effective way, and then we could probably follow up that as well.
Thank you.
All right, I think our next question comes from Dr. McGall.
Thanks, Tim. I thought it was a really good talk. I appreciate that. So I have a question from the perspective of the institution. Are we doing everything that we need to do? Do you feel, as an athletic trainer, as the head athletic trainer, do you feel that you get good response from faculty? Is there anything else we need to do? Do we need to add maybe something to the faculty handbook so faculty members will be aware of the process that we go through? What are your thoughts?
Yes, I think we should probably update what we have available in terms of where it's housed. If it needs to be in the faculty handbook, if it needs to be in staff handbook. I know we have a little subcategory within our athletic training handbook about what we're going to do on this side of things, but I think clarifying roles, communication, and expectations would be helpful. So, you know, you can say that if it's, you know, 5 days afterwards and you haven't heard anything, then that might be a pretty good sign that that person's doing well. Conversely, if it's 5 days out and that person still has a score of 80, then that definitely needs to be communicated that person's having an issue. So I think written policies, like referenced in materials earlier, is going to be the best thing to have. I think overall, we're doing well, but we're not by no means perfect. So I think if we had a clear expectation about the communication on all sides of it, that would be helpful, as well as maybe ensuring that the student athletes are, you know, aware of what their responsibility is with this. You know, we give them a little take-home sheet that includes, you know, the red flag concerns and all that kind of stuff, but doesn't go necessarily as great detail about what they need to do as it goes in the classroom. And the problem with going over these things verbally with them is, one, they are concussed, so they may not be absorbing all the information. Two, they're probably focused on the fact that they're not playing and they're worried about that versus all these other sub-steps. So I think revising the policy by and large would be the best thing to do.
Thank you. I appreciate it.
All right, other questions?
And to follow up on Mir's comment, maybe what we need to do is set aside some time at a faculty meeting to actually make sure that faculty do understand concussion protocol notification and what our role is.
Yeah, we do have a part in the faculty handbook that talks about disability services, and it's not a disability service per se, but it's an acute or temporary issue that we need to deal with. And I wonder, looking at the faculty handbook, if we don't need to create a few words over there so faculty will be aware that there is a process in place. So if an athlete has a concussion, he or she needs to go through a few steps and be clear to come back to the classroom. I think that my conversation with a lot of faculty members, especially not on our end of the whole, so Shannon and I and faculty members that have a lot of athletes, many are not aware that that's the situation. So maybe we need to put it in writing.
And that's what I was thinking too, Mir. We put it in a handbook, but again, sometimes that doesn't always get to the attention of the faculty. I mean, sometimes we need that verbal reminder.
Absolutely.
I certainly agree. I think it's easy enough to set up such a reminder at a faculty meeting, which is not a bad idea, or periodic. emails through the semester. What I hear most from faculty members is confusion about what happens next. We're really good at the communication at the front end that this student's been concussed, and here's some of what that might mean, and people know that. I think when to expect return, how the student's going to communicate with them, what they might expect to learn, how they might be asked to modify assignments or courses. That part is where sometimes people are sort of like, well, I knew they were concussed, but I don't know when to expect them back. I don't know expect what to hear from them. I think that's kind of the next step we need to improve the communication on. And some of that goes through the student, but we also have to recognize the students, by definition, sort of in a moment of diminished capacity. We can't expect that they're gonna always be the best source of information about what they, where they are in the process.
All right, looks like we have a question from Dr. Brewer.
Yes, I am so happy that I joined this presentation because I'm learning so much. I think, Tim, I recently got an alert regarding one of my students, and echoed by some of my colleagues here. I didn't know what to do. I received it, and she came back to class, and there was no discussion. And I was concerned whether or not there were any accommodations. I know she asked extensive questions about the upcoming test, and just listening to this presentation. In fact, I've sent you an email while you were talking regarding a follow-up, whether or not has she clearly been recovered from all the problems that she may have had, because I know she was very concerned about the upcoming test, but at the same time, she appeared okay. So having heard this presentation, I definitely see the need that I need to determine whether or not is it okay for her, or are there any accommodations that I should take into consideration regarding her. And as far as the other information about the handbook and sharing with faculty, if any of them is anywhere where I was, I think would be extremely helpful, because I was completely naive as it comes to concussions and students returning to class. And I guess I apologize for that, but this kid was my first alert. So I'm appreciative of this presentation. Thank you.
I would love for fewer alerts to be going out about this in general. I think that's one of the big challenges. There's sheer number of them. But yeah, I think, like I said, we're going to hopefully be able to communicate a little more openly about that. So I think I want to let Ms. Carroll follow up on that too before I say too much on it.
Yeah, I just wanted to kind of address kind of the concerns that you've raised. Anybody that has those, especially those higher symptom scores, we definitely refer them to our accessibility services. However, some of them choose not to go. And so that's when you get that student in your class that may be asking those questions and about the test and being concerned about an assignment and this, that, and other. And especially some of your better students, I think they don't like that stigma, kind of like the mental health type thing of actually going through accessibility services and having to have some kind of modification. So they try to do it on their own, and then now they've straight A student, and now they've made a C on a test, and now they're in a panic.
Mm-hmm.
But yeah, there's many times that we send them and ask them to be in contact with our accessibility services, but they do not follow through, or they are delayed in following through once they realize they weren't quite as far along in their recovery as they thought.
Gotcha.
So yeah, that's where that communication is so important between our staff and the faculty. We're all working together with this. It's like Tim said, it's very stepwise, it's very individualized. And if they've had more than one concussion, then, that can make the symptoms worse for them, this second time around and so forth. And so what they did the first time may not work for them the second time. And so again, we can come up with some, steps, and that may be helpful, but still it's going to be a two-way street as far as us communicating. Just keep in mind now that most are going to resolve within that 10 days, and it's anybody that goes beyond that 2-week mark, we're probably going to start looking at referring them on to possible, we may even be looking at students that may have to either drop classes or things of that nature. We've had some that have had to medically withdraw. So, yeah, so communication, please let us know. I'm kind of the point person. If you don't know exactly which athletic trainer it was, certainly reach out to me and we can get it resolved.
All right, do we have any other questions for Tim?
Or in general, since we got everybody here. I'm gonna take that.
Wonderful talk, obviously stimulated a lot of great discussion and hopefully some plans going forward. So thank you again, Tim, for the talk and for serving as our first speaker. I'll send more information out about future events with the Lunch and Learn series. But again, great job. That was wonderful.
Thank you.
Thank you.
Thank you all. Take care.
Thank you.